नमस्कार, मैं डॉक्टर अपूर्व दुआ, स्पोर्ट्स इंजरी एंड जॉइंट रिप्लेसमेंट स्पेशलिस्ट हूँ. आई हैव डन माई स्पोर्ट्स इंजरी एंड जॉइंट रिप्लेसमेंट फेलोशिप्स फ्रॉम मुंबई. आई एम वर्किंग एट Apollo Spectra group of hospitals, Chirag Enclave, New Delhi. So today we will be discussing about knee joint and the injuries associated with the knee joint, and the most commonly asked question which we get by every patient and most commonly searched online question about the knee joint, that is an ACL injury. So before we move on to ACL injury, I like to explain you what is a knee joint, what is an ACL, and what are the other ligaments in our knee, and what kind of injury can happen to the knee. So this is a human body diagram. It's a graphical representation over here. In this is the representation of a right knee. This is the femur bone, this is the tibia bone, and this is the patella, which is also known as kneecap. So now the knee is basically a joint which has its movement in extension and flexion. So everybody knows that knee move like this. So these are the movements which are occurring at the knee joint. In the knee we have different ligaments and menisci. So what are ligaments? Ligaments are the structures which join your two bones together. So for knee, in this case we have femur and tibia, which are joined together by multiple ligaments like ACL, which is an anterior cruciate ligament, PCL are posterior cruciate ligaments, and two collateral ligaments, medial and lateral. Along with this, there is a cushion inside the knee joint which prevents further injuries to the knee. So this cushion, this like structure which you can see here, is basically a menisci. Menisci is nothing but a cushion between your two bones, and when you do jumping or activities like that, it helps to prevent injury to any of the bones. Now what is an ACL ligament, which is the most commonly injured ligament in the knee joint, and everybody talks about it, everybody knows about it. So let me explain to you today what is it exactly. So exactly, a ACL is a ligament or a thread-like structure made up of multiple fibers which exist between two bones, the femur and the tibia. If you see from here, this is the structure which is called as ACL. The function of ACL in a knee joint primarily is forward stability, or you can say anterior stability of the knee joint, and the secondary function of the knee joint is a rotational stability. Of the ACL is a rotational stability. The ACL ligament is stabilizing the knee joint in forward direction, and the secondary stabilizer, it acts as rotational stabilizer. So the basic purpose of this ligament is forward stabilization and the rotational stabilization. Today I'll be talking about the injuries of this ligament ACL, and I'll be addressing the questions which have been asked frequently on Google, on WhatsApp by my patients, that what is this ligament, how is it injured, what can we do when it's injured, how to diagnose it. So I'll be addressing all the queries that you people have today with the medium of this live update.
What are the common causes of ACL injuries?
So as I have told you, this is the primary stabilizer of the knee in forward direction. So what are the common causes? The common causes are very simple. It is injured due to direct trauma to the knee joint, a direct injury, maybe a road traffic accident, or contact sports like football, rugby, kabaddi, wrestling, even cricket. So all these sports, when you have a direct injury to your knee, or maybe a load transfer due to pivot on your knee, you can lead to an injury to this particular ligament of yours, which is called as ACL. Now you must have heard about a lot of sports people who have had this injury. Recently our famous cricket player Rishabh Pant had this injury. So that is how the injury can occur. It can be a road traffic accident or maybe through sports.
How is the ACL injury diagnosed, and what are the key diagnostic tests?
So this is a very tricky question, you know. Everybody asks me, how do I know I have an ACL injury or not, whether it's complete or partial. So the key to diagnosis of ACL injury is you have to go to your doctor and get it checked. So the first thing is clinical diagnosis. When there is an injury to your knee and the ligament is injured, the ACL ligament is injured, you will develop a lot of swelling, there will be a lot of pain, there will be tenderness, you won't be able to get up on your own or even walk around. Sometimes the injury doesn't come with a lot of effusion or swelling. In those cases, when you visit your doctor, we do a lot of clinical examination. That means we check you. We make you lie down on a bed and we check your knee clinically, that what has happened to it. So there are different tests for us to check for it. We see for the anterior, posterior or forward translation of the knee joint, whether it is stable or not. If your knee is moving out, if your tibia is moving out of your femur, that means you have an injured ACL. If it is rotating like this, it is coming out of your femur again. If your knee is not stable, it is coming out, that means you have an injured ACL. Now, once I have seen you, we have seen you clinically, evaluated you, the next step is going for a radiological investigation. That means getting an X-ray done for you, checking whether your ACL injury is with bone or not, the bones are intact or not, and then doing an MRI. MRI is the most sensitive investigation for knee injuries, but even in MRI, you have to be sure the MRI is of good quality. It is of more than 0.5 Tesla. 1.5 Tesla is the standard. We have to go beyond that, 1.5 Tesla. If we don't go beyond that, we will not be able to actually recognize which of the fibers are injured and how much is the grade of the injury of your ACL ligament.
What are the different surgical options for ACL reconstructions and how do they offer different?
Okay. So for ACL reconstruction surgeries, what we do is we do this surgery arthroscopically. That means it is done through small holes in your knee joint. We make keyholes in your knee joint and then we perform these surgeries. There are hardly few holes which are made here around the knee joint, and we perform the surgery through that arthroscope or camera inside your knee joint and some hand instruments, small instruments which we put inside the knee. We have a lot of different options in arthroscopic ACL reconstruction these days. We used to use, earlier we used to have open surgeries for this, but now nobody does an open surgery. It is all arthroscopically. So we can go for different graft choices depending on the person and age group. Different graft choices can be quadriceps graft, we can go for peroneus longus graft, we can go for hamstring graft. So different graft options are available for different patients. In this scenario, it depends where is the injury, when it has occurred, what is the activity level of patient, and how much return to sports does the patient want. So all this depends on the type of surgery we are doing. We are doing internal bracing also for patient who need a quick recovery and need a stronger ligament than normal. We are doing all internal bracing also, all internal ACL reconstruction also. So everything depends on the demand of the patient and what type of surgery does the patient require.
What are the patient-specific treatment plans?
Yes, exactly my point. So the patient who is coming to me, I need to know his needs. What is the basic need of the patient? Whether the patient is an active athlete, whether the patient has a sedentary lifestyle, or whether the patient is a weekend sports person. So I need to know the basic demands of the patient. I should know what he wants out of his life, how much active the patient is. If the patient has a sedentary lifestyle, maybe they don't need a surgery for their ACL ligament. It's not necessary that they need a surgery. If they are happy walking in a straight line and not getting back to sports, they don't need a surgery. But patients like who have a very active lifestyle and who are athletes, we need to do surgery for them. We have an option of internal bracing, fiber tape augmentation for patients who are heavy built or have a huge body structure. For them, we might need to augment with internal bracing or fiber tape. We can go for all inside ACL reconstruction, which has been used for children, people who are still the growth is pending, and for such patients we can use all inside. There are different materials and grafts available from the same patient body which we can use for reconstruction of this ACL ligament.
What factors influence the choice of graft material in ACL reconstruction surgery?
So the factors again depend upon patient's activity level. So if the patient is very athletic and a gym goer maybe, and he has a good hamstring muscle strength, I'll go for hamstring graft. If the hamstrings are poor, I might have to take a graft from the ankle, which is called as peroneus graft. For athletes, we sometimes take a BTB graft, which is a bone patella bone graft. And for patients who have not very thick hamstring but need a good support, we might have to add internal bracing or fiber tape to that. For patients who have a less length of hamstring, we do an all inside type of graft. So it actually depends on patient's need and patient's pre-activity before the injury that we decide the type of graft he wants.
What are the potential complications and risk associated with ACL surgeries?
As all the surgeries in the world, every surgery has the potential risk involved with it. So to start with, I can say there is a risk of infection always associated with any surgery. Then there is a risk of graft failure also in some surgeries. Then there's a risk of lengthening or loosening of the graft. Then we have a risk of failure of graft securement, which we do with bioabsorbable screws. Then there's a risk of hemarthrosis or blood inside the joint. Then risk of recurrent effusion is there. But I would say it's potentially a safer surgeries because it's been ages since we have been doing that. I have myself performed more than 1,500 ACL surgeries, and hardly for like 4-5 patients who had some complications. That too also could be handled well. It went well. So it is not a extremely risky surgery. It is done routinely nowadays and with proper precautions and sterility in your operation theatre. Yes, you can do a very good surgery and come out neat and clean with the surgery. We need a good physiotherapy for post-op rehab so that the complications are not extended by the patient or the doctor.
What is the typical recovery timeline after ACL surgery, and when can a patient expect to return to their pre-injury level of activity?
So the typical recovery time for after an ACL injury is after 1.5 months. The patient can walk with a stick. In fact, sometimes they walk unaided after 1.5 months of surgery. It takes usually 3 months to get back to normal gait and normal walking, and to return to sports, I would say it's at least 6 to 8 months, which is the minimum requirement which should be actually done. That this much time is actually required for the patient and his body to recover and return to sports. If you are doing that early, if you are returning to sports early, that is not advisable because your body needs time and the ligament needs time to heal with the bones. So it is always advisable to return to sports after 6 months of surgery.
How can patients prepare for ACL surgery, and what can they expect on the day of the procedure?
Okay, so that is a very good question actually. What should be the how can we prepare ourselves for surgery? What are the things which we should do before the surgery which will help us have a better outcome after the surgery? Yes, so I need complete support from my patients. A patient should have a good knee strength before getting operated for an ACL surgery. He should have a good range of motion. He should be able to completely move his knee up and down completely so that there is no restriction of movements post surgery. Then the patient should be emotionally and psychologically well counseled for the surgery, because after surgery you might need some rest and you will need a lot of dedication and physiotherapy for the surgery to regain your power and return back to sports. So yes, a lot of preparation is required from the patient side. On the day of operation, we usually operate you in the mornings and it takes 1.5 hours for the surgery. 1 hour, 1.5 hours you are inside the operation theatre. After that you are in the recovery room for next 3-4 hours. After that you are shifted to your room where you can start eating, you can start your daily activities, you can go to the washroom on the same day. We don't allow a lot of weight bearing on that operated leg. You can touch your leg down and walk around, and our physiotherapist will come and guide you how to walk. So you can return back to your normal activities in the same evening.
Are there any advancements in non-surgical treatments options for ACL injuries?
Yes, that's the most commonly asked question. Nobody wants to get operated. Non-surgical, conservative management of ACL injury. ACL can be managed conservatively. It is not something that has to be operated in every patient. It depends what is the demand of the patient, what is the need of the patient. If the patient, as I told you, is of old age, maybe 55, 60-year-old, has a sedentary lifestyle, doesn't go out much, doesn't need a lot of sports activities, yes, you cannot get operated. You can stay like that. You are given some medicines, and yes, you can have a good life after that, no issues. But patients who have a lot of active sports involvement and who have an active lifestyle, who want to get back to playing and want to get back to running and you want to do gymming, for those patients we should operate an ACL, because ACL, if not operated, will lead to instability in your joint, and once your joint is unstable, it will lead to damage to the bones which we have just discussed, the tibia and the femur. So this movement without an ACL is not possible. It will go like this, it will go haphazard. If it's going like this, your bone is getting damaged, and once your bones start damaging, you know what happens. It is called as arthritis of the knee. Then it leads to a knee replacement surgery maybe later on, which you would have required by the age of 70. Maybe you might need the same surgery at an age of 55 or maybe earlier if your joint is degenerated. So ACL has to be operated in active people. It can be conserved in less active people and people who have a less active lifestyle. Now, how to conserve this ACL? How can we prevent the ACL? What are the modalities? There are a lot of modalities available these days. We can go for just simple medicines and rest, which actually helps the ligament to heal if it's a very little or a partial tear. We can go for growth factors also. Growth factors are nothing but some special type of cells which are taken from your own blood, and we concentrate your blood and then we insert those growth factors into your own knee joint. We can go for PRP also, which is known as platelet rich plasma. We insert that into your knee, and that helps the knee and the ACL ligament and healing. The graft is accepted better and it heals better when we have inserted PRP in your joint. So yes, there are a lot of modalities available these days which help for us as a doctor to preserve the native ACL of the patient and conservatively treat the ACL.
What are the long-term implications of an untreated or improper managed ACL injury?
So as I have discussed earlier, an ACL injury, if not managed properly or if left untreated, can lead to further damaging of your meniscus, which is a cushion between your bones. And once this cushion is damaged, the bones start, if there's a cushion between your bones are not actually colliding with each other. When this cushion is damaged, the bones start colliding with each other with every stride you take. With every step you take, the bones are colliding with each other, and this will lead to damage of the articular surface or the joint surface of your bone, and this in turn leads to arthritis of your joint. And arthritis, as you all know, is degenerative disease in which the joint surface is actually hampered. So to prevent that, we need to operate an ACL injury or manage the ACL properly. It's not just operating, it has to be done in a proper way. So the stability has to be restored to your knee.
What are the best practices for post-surgery rehabilitation and physical therapy?
So operating a knee or just getting an ACL done, ACL surgery done is not the solution. We need a very good post-op rehabilitation after ACL surgery. So the best practice I would say is consistency and dedication. You need both of them for your post-op rehab. If you are not consistent with your rehab, if you are not dedicated with your rehab, you will not achieve a good result. You need to do an early mobilization and early strengthening of your knee joint. Early mobilization leads to a better mobility of the joint and prevents stiffness. Early strengthening of your joint gives more blood supply to your muscles around your knee joint, and the ligament which has been placed by us is accepted faster and better if you are doing a better physiotherapy, mobilization and strengthening of your knee.
How can athletes reduce the risk of future ACL injuries after surgery?
So nothing can be forever. we don't know, you never knew that you might injure your ACL ligament. Same way, I cannot guarantee you what things can be done which can actually help the athlete to prevent injury or actually prevent any kind of trauma to your knee joint. But the best thing that an athlete can do is strengthening and proprioception exercises. So proprioception exercises are the exercises which help you gain the native consciousness of your joint. So once we have made a new ACL ligament, the nerves inside it which send the signal to your brain that this is how the joint is moving are damaged. So once we have made a new ACL ligament, you have to train those nerves again. We have to train the new nerves which are being formed around it about the movement of the joint. And once you are doing good physiotherapy, functional training and proprioception training, you will be less prone to further ACL injuries or injury to your reconstructed ligament.
What is the role of bracing and orthotics in ACL injury management?
So bracing and orthotics can be used very effectively in partial tears, in the tears where all the fibers of the ACL are not torn and some fibers are left, maybe more than 70-80% fibers are intact. Yes, you can go for bracing and orthotics. Bracing provides support to your knee joint and your knee is moving in one direction only. It has been protected from outside by braces. So it protects the ligament from further injury and gives you support while walking, and that way you can prevent further injury to your partial torn ligament and strengthen it, and maybe that will help you to prevent the surgery, and you might not need a surgery after that if you have done proper bracing at the proper time.
How can we prevent ACL injury?
Prevention of ACL injury is very important. So like any sports injury, we have to do a good warm-up, good strengthening of the knee, stretching of the knee. Athletes who are involved in contact sports should always go for proprioception training, and they should always get indulged in strengthening exercises of the knee joint specifically to prevent injury to their knee joint.
What is the return to play criteria after the ACL injury?
So yes, that is a very good question because everybody wants to know when to go back to sports. So I would say you can go back to sports once you have gained 80 to 85% of strength of your opposite knee. If you can achieve that much of strength in your operated knee after ACL injury, yes, you can return to sports.
Are there any strategies for minimizing pain and discomfort during the recovery phase?
Yes, a lot of things can be done to minimize the pain during recovery phase. To start with, you can apply ice, then rest is very important. Then we can go for some painkillers if there's a lot of pain. Early mobilization is again a key to prevent chronic pain in the recovery phase. Then you can go for proprioception exercises, and a lot of TENS therapies are there, but the good part is ACL surgery is not very painful. On the day of the surgery or maybe the second day of the surgery, you might feel some pain. After that, it's all upon physiotherapy and training, and your pain is not a problem for you. Don't worry.
At the end, Doctor, can you brief us about your experience and expertise for the same ACL surgeries?
So yes, I like to tell you ACL surgery is a highly specific surgery which is done arthroscopically. Not every doctor is trained to do that. There is a lot of time frame which is involved in learning these surgeries and how to do these surgeries. For me, I select my patient wisely. I select what ligament has to be taken from his body to reconstruct the ACL. Then I select at what procedure should I be giving him, like whether it has to be an internal bracing, whether it has to be an all inside technique, or maybe I have to take a peroneus from his ankle. So all things I consider for my patient, and I have been doing that for the last maybe 10 years, and I have done more than 1500 surgeries, and to my account I feel everything went well by now, and small hitches were there, small complications have occurred to few patients, like maybe 4-5 patients, but which is a good number, I would say. To summarize my topic today from knee joint ACL injuries, I like to tell you that it is not something you should be afraid of. It is a very simple procedure, arthroscopically done by keyholes. Your own ligament is restored, which should be done to prevent further damage to your joint and further injury to your joint. Otherwise, it might lead to arthritis if you have a good sports activity or a good active lifestyle. For any further queries or inquiries regarding ACL surgeries or sports injury surgeries or arthroscopic surgeries or joint replacement, you can contact me, Dr. Apoorv Dua, working at Apollo Spectra Hospital, Chirag Enclave, New Delhi. You can also take an appointment by logging on to our website. Thank you.